Ladies, it's Dr. Kimberly Evans, board certified gynecologist with over 20 years of experience, and I specialize in cosmetic gynecology as well as sexual wellness. So I'm here to answer the question of what is the difference between a perineoplasty and a vaginoplasty today. So I have my little handy dandy model here. So today we're going to be talking about what is the difference. So realize, what is this for? Let's talk about that first, okay? So there's some ladies who, as we age, and this is a usual conversation I have with a lot of ladies, because some ladies, they feel like, oh my goodness, I'm alone. This is taboo. I don't feel like myself. It's harder and harder to have an orgasm, and they're thinking like, is my partner still satisfied? Why is it taking him so long to have an orgasm? These are all the things that I hear from ladies. So I just want to let you know that, hey, it's okay to have this conversation. Sexual wellness is out there. I believe that this is a healthcare thing that all women, we should be entitled to. And, these are things that are out there that can help us feel and look our best. So today I'm going to be talking to you about two of the more common ones that can actually help you in this area. So again, let's talk about the difference between the two of them, okay? So perineoplasty, the perineum is something, if this is the vagina, this is the rectum, the perineum is actually between those two. So I'm going to actually zoom in here just so you can see. Perineum is between those two. Again, vagina, rectum, perineum is here, bladder's here, this is uterus, and then tubes and ovaries are on the other side, okay? Again, this is for women that have not had a hysterectomy, okay? So the important other thing that I want you to know about is that with this, the perineoplasty basically tightens, if you look at the outside, it tightens the outside of the labia, versus a vaginoplasty, it actually goes in deeper, like it goes back further. So some ladies, this vagina is not a problem, meaning that they can have orgasms like normal, things like that. Other ladies, especially the ones that have actually had babies, this becomes a lot more lax. And knowing that this is where we have outside orgasms, this is where we have inside orgasms. So the more lax this area is, it's harder to have an inside orgasm, as you can see here, okay? So I just need you to know that, hey, if we correct this tissue, then that may actually help this area, okay? So again, all women are different. Certainly, you definitely need your exam to figure out exactly, what you need, what you want to correct. But again, perineoplasty corrects the outside. The perineoplasty vaginoplasty combination corrects the outside and the inside. Usually when we do these procedures, the perineoplasty is done, or the combination perineoplasty vaginoplasty. Very rarely do I do a vaginoplasty only, because usually as I tighten this actually has to follow suit and actually look more appealing too. So it's just kind of word to the wise to let you know that, hey, if you're out there, if we're losing the confidence because of a lack of, because we have more laxity in that area, these are things that you can do to help restore some of that confidence and feel more like yourself, okay? Love to me is always in the air. I think that aging, multiple things we go through, childbirth, various things like that, it kind of robs us of what we should be feeling and, some of the things that are out there. So this is one of the things that can help you. Now, mind you, again, this isn't for everybody. We do have some great non-invasive options. So I'm a big advocate of the Infem 360 that does radio frequency non-invasive tightening. That's something that can actually help tighten the vagina here, as well as help tighten the perineum, as well as the labia here. That one has no downtime. The bad part, or the downfall of doing the actual surgery, is that of course it does have downtime, because you do want to make sure that your stitches dissolve, you heal properly, you reduce the chance of having wound breakdown, things like that. So that's why, we do have those great options that are available. So please feel free to visit us today, www.sugarlandmedspa.com, or feel free to give us a call for a consultation. We'd be more than happy to help you to determine if non-invasive tightening will be enough, or if you need surgery. So again, we're here to help you. And that is my talk today on the difference between the perineoplasty and the vaginoplasty. So feel free to subscribe, hit that like button, tune in more for more videos like this. Take care, peace and love, Dr. Evans.